Hello viewers, I'm making this video in Gangnam, Seoul, South Korea in Facelift Plastic Surgery Clinic. And today I'm going to talk about something I think is rather important for the patients to understand before they come to our clinic. As our clinic specializes in facial rejuvenation and anti-aging procedures, patients come to our clinic mostly complaining about facial sagging. When I browse the internet about facial sagging, I see a lot of information on procedures that address facial sagging, such as surgeries or other minimal invasive procedures that can reverse sagging. I can't find any information on why the face sags, and I think understanding why your face sags is more important than understanding how your procedure is going to be done to your face. You have to understand the cause of your facial sagging to completely understand what kind of procedures you need to address your problems. So today I'm going to talk about the causes of facial sagging and why your face sags down with aging. The aging process, especially in the face, is mostly about losing volume. Around the abdomen and the thighs, maybe you can gain fat when you get old, but in the face, your fat decreases and also your muscle decreases. And finally, your bone mass also decreases with aging. A lot of causes of facial sagging are mentioned. So there's no one cause that can explain everything, but mostly they have one or two things written in their textbooks, which are your ligaments, they get loose, making your face sags down. And also repetitive movement of the muscles in your face, they make your skin more wrinkly and lax. And also you lose muscle when you grow old, so that causes volume loss. And also you lose fat. That also causes volume loss. So it's like a deflated balloon and your skin and your tissues get left over, which sags down. And finally, there's also bony changes. And these bony changes are quite significant if you look at CT scans of people who are young and who are old. Your bone gets very much smaller and you lose a lot of volume in the deep tissues that causes these laxities. And in my opinion, as I have done a lot of cases of facelifts, I think the major cause of facial sagging is actually bone loss due to aging. Of course, ligamentous loosening, that also happens because probably that's also related to bone loss, because as your bone gets smaller, these ligaments are what attaches your skin and soft tissue to the bone, and as your bone shrinks, these ligaments get longer, which causes laxity. So when you hold your face between your fingers, if you hold the thick tissue here, this is what we call the SMAS layer. And probably you've heard of it if you're interested in facelifts, because usually when you do facelift, you manipulate the SMAS layer. And this SMAS layer is actually attached to the platysma muscle on the neck. So many people think this is fat, but actually this thick tissue, this hard tissue is muscle. And this muscle and this SMAS layer is interconnected with fibers. And these create one layer above the deeper tissues like bone, or masseter muscles, or the parotid gland. So we have to manipulate the SMAS and the platysma muscle and reduce the volume of these layers to actually reduce the sagging of the face. So today I talked about the causes of facial sagging. And looking old is not all about sagging, but there's also loss of volume, as I said earlier. Like you lose volume of your muscles and your fat. So in some cases, loss of volume is more significant than sagging, so that has to be addressed first. And in some cases, sagging is much more significant than loss of volume, and that has to be addressed first. As I said earlier, the primary cause of facial sagging is actually bone loss in the face. And this bone loss has to be treated with sufficient dissection underneath the SMAS and platysma muscle for long-lasting results. And so the final purpose of anti-aging or rejuvenation surgeries are to make you look younger. And there's no one method that fits everyone that can make everyone look younger. And you need individual consultation with a plastic surgeon to find out what kind of procedures you need to improve your aging face. Thank you for watching.